in today's new cost basis environment, I wanted to highlight a few numbers that jump off the page at me being on this side of the dental curtain. So when we provide a 1 hour post-op appointment, so if we do an extraction case, we'll normally schedule a post-op with that. After different procedures, we will always provide a free post-op appointment for any reason. If a patient wants to, just wants to come back in and make sure everything procedurally went well, we are happy to do so and schedule a lot of post-ops. What is interesting to me in today's new environment is how much that 1 hour post-op appointment costs the dental office. And on average, that's between $185 and $215. When you take in overhead, which can include wages, but in this one we'll call it a variable expense. When you include overhead, wages, and consumables, that is what that number breaks out to. That to me is absolutely wild, as we'll normally have 4 post-op appointments scheduled a day. So when you do that math, you can easily get over $800 of expenses just so you can provide adequate quality post-op appointments. So that number continues to go north as our fixed expenses keep going north. Our health insurance is going up again this year. Our rent is going up again this year. Patterson Guaranteed is going up again this year. So every year providing post-ops actually gets more expensive. So was interesting to see a number really quantified to that. You can put the same number for a missed or failed appointment from a patient as well. The consumable spend won't be there because obviously the patient's not there. You're not going to be using anything. However, when you talk about opportunity costs, that's where your new patient or your patient appointment fail gets really ugly. It's still about $200 just from an overhead standpoint of them not showing up because you have the staff there, you have the equipment there that you're paying on, just not using. So when you talk about missed appointments, the opportunity cost number gets massive. That can be anywhere from $300 to $600, depending on what proficiency that is of the doctor in that office and what was scheduled out of that chair. So comment down below, let me know what jumps off the page at you guys. But I think these are interesting numbers for both the patient and the clinician, just as a lot of times I still hear patients coming in like, man, this stuff is so expensive. Again, think about that. There's a lot of times on certain procedures, we don't even net make $200 cash. So when you schedule a post-op appointment on a procedure like that, you're actually losing money on the procedure when you take in all of the expenses for, again, said procedure. So comment down below, let me know what jumps off the page at you guys, and let's have a great 2025.